Hi, this is Liz at SmartPlex ATL with Dr. Elmore Alexander. Today we were having our Botox party. Also got a lot of other things going on here. In fact, even though we're having a party today, we are pre-planning a little bit for an event coming up in January 5th that I'll let Dr. Alexander tell you a little bit more about. But first I want to ask him a couple of questions, specifically about the Botox. I know a couple ladies left here really happy. They complained a lot less about pain. Dr. Alexander, do you have a particular technique that you use when you do your Botox that would keep these ladies as happy?
Well, I do have a trade secret, and I'm not going to tell everybody what I do right now, but there is something I do differently than most other practices, and it allows me to be able to cause less pain, less swelling, and it's just a much more pleasurable experience.
Absolutely. I can tell you I've had a Botox from Dr. Alexander, and I have a tendency to have the tears rolling down my face. It literally did not happen this time at all. I barely teared up. So he does have a secret technique. I also noticed that you've started, because of the banner over there, that you've started doing Kybella. And I know I've heard a couple of people refer to, especially during the holidays, that some women are doing sort of a Kybella for your fella. Not that we're going to fault the guys for having that little double chin, but if we make them a little bit prettier, that works too. So what can you tell me about Kybella? Is there anything it's going to do for me other than just get rid of the fat?
Well, Kybella is a game changer, because some of the other treatments that we have, like liposuction, it's very invasive and it's painful and there's a lot of downtime.
Right.
With Kybella, there's no downtime at all. What we have is a very special chemical that goes in. It's not really painful, and it lyophilizes the fat. Now, what that means is that it destroys it.
Great.
So any fat that it destroys, it's gone forever.
Good.
And this is without surgery.
All right.
So it's one of the best things that we've had recently.
I'm curious about something, because I actually, speaking of Kybella for your fella, I considered it for my husband. Something that scared him off was that I read online that he has to go in 6 times. Have you found that to be true? Is he really going to have to come see you 6 times to get stuck 6 times?
No, the most that I've seen is 3 times, but the average is 2 times. There are a lot of people who only need 1 treatment, but the average is 2 times.
2.
And we can do some things with the skin to make sure that there is no pain. Great. And again, I have some secrets that maybe some of the other people don't have, and so we can make it almost a painless procedure.
We'll take it.
Yes.
So the event January 5th, I understand it's going to be about the O shot, which is about women's sexual rejuvenation. Sensitive subject. That's one of the reasons that we're having a luncheon, is so that these women can sit still, they can take their time with it, they can have a chance to relax. Just kind of superficially, is there anything you can tell us about that O shot that these women should know if they're considering coming in just for the luncheon, not necessarily for the procedure, but just to learn more about it? Is there any little push that you could give them, or any little bit more of information that would maybe bring them in just to learn more about it?
Well, sexuality is a very tough topic.
Yeah.
And when you're having problems with sexual dysfunction, a lot of times people are very self-conscious about it. And there are many layers when we start to talk about this, and it affects people in different ways. But what I can say is this, that one, I think that it's very, very important that people have that closeness. It improves communication in relationships. And what we found is that when we're able to fix those problems that women are experiencing, and I shouldn't just say women, because there's a P shot for men as well, but the reason that the O shot is so important is because if you look out there in the media, if you look out there online, if you go to your doctor, there are about 20 plus procedures and actually medications for men.
Yep.
And there's only one medication that is very dangerous for women that will help with sexual dysfunction.
And it takes 2. It takes 2.
It definitely does.
It takes 2 to take.
And when you think about any other things that are out there for women, there isn't anything. But this O shot, it can change the whole dynamic of a relationship. It can take a woman from having pain with intercourse and dryness to having lubrication, self-lubricating without using any type of topical lubricants, and having pleasure again. Great. We can also restore the ability to be able to have pleasure, and reach an ecstatic point within the intimacy. So that's important. But there's another part of the O shot that is very, very, very important. And that is, a lot of women, after they've had babies, they have a little bladder leakage. There's a little cough, sneeze, leak that they have. The O shot will actually fix that problem of stress incontinence. And that is invaluable for many women. You know, they don't have to wear pads anymore. They don't have to worry about laughing and leaking. They're able to exercise. A lot of women have problems when they exercise with distress incontinence. We can fix that with the O shot.
So you heard it, ladies. No leaking, lots of love. January 5th. Come out, hear more about it. Thanks for stopping in.
Thanks, Liz. It's been a pleasure.
Thanks, Doctor.